So for adjustments, one thing I hear consistently from patients who go to chiros is that they're putting my joint back in place. Like I had
Yeah.
my cousin had said a chiro told her once that her femur was dislocated, and
Hmm.
I kind of was surprised by that diagnosis, but just because if her femur was out, she probably wouldn't be able to be walking. But um,
Yeah.
for the adjustments, are they mostly, are you trying to get like joints back into places, and is that's what you're telling patients, or is it more like that neuromodule, like that neurophysio change that we're looking for that relaxes the muscles and allows for the spine to kind of get back to some sort of normalcy or kind of a new baseline, so to speak?
Yeah, and I think the joint into place is just an easy way to communicate that to some public, right?
Okay.
They understand that easier than saying, what you said. Like it's important to get the neuromodulation and the neurology of the nerves communicating properly, so it's not hypertonic or hypotonic. They're like, just tell me if it's in place or not.
Yeah,
So I
yeah.
think that's what some chiros just go to because it's easier.
It's
And
easy
again, it
buy-in.
is, yeah, and it's easy, and it's just important to have the patient know what you're talking about, right? But again, it's probably not putting it back in place like it was dislocated and now it's put back in place like that, right?
Mhm.
However, it's just, but it is, the joint is not able to move or do what it's supposed to be doing properly, right? And
Mhm.
that can have a chain reaction for the whole thoracic spine, for the pelvis, um, up here in the upper cervical spine. All of that can, when you just have a joint that's tightened up or not aligned properly,
Mhm.
can cause a whole bunch of issues. Can cause everything to get hypertonic, which then can compress the space in that area, can refer pain up into the head for headaches. It can do a lot of different things. So I think the adjustment is kind of like a combo. Like you do adjust that joint to be put back in a more ideal placement to allow the nerves and everything else that's holding on super, super tight, that's causing that headache, to go, oh, okay, so we're in the right place now. I can chill out. I don't need to be causing this person a headache, right?
Yeah.
So I think it's more along that, where you're just trying to get the spine to move the way it's supposed to. And not everybody, what's interesting is that not everybody's supposed to move the same. Some people are just more inherently stiff than others.
Mhm.
And you kind of have to judge, do I want, is this ideal, not ideal? Should I be adjusting that or not? And that's kind of where the art of chiropractic comes in, for sure.
Yeah, and I think PTs definitely do that, and just obviously in a different way. Of course, looking at, if you see someone who has scoliosis or any kind of impairment of the spine, you may be trying to do some mobilizations, or you may even find an exercise that is almost like a self mobilization that can get them into the motion that they need to and change it. And it's just two different approaches. Where, for those that don't know, chiros are definitely getting way more hands on most of the time, where they're trying to again facilitate that joint back into a normal alignment, where PTs may try and find exercise to push them into an area that will allow them to get back to some sort of normalcy with their movement, even if it's not ideal sometimes. Like you said, some patients are more stiff, or sometimes they just had, they moved a certain way for their entire life, so it makes it difficult for them to get back to a normal position. But again, I think it's good that we kind of can establish that of like the difference between the two.